We are getting yet another update on the spread of the coronavirus. Let's listen.
And that starts with our port workers, as well as the residents who live closest to the Port of Oakland. Second, I want to ensure that our public and our community keeps constantly informed with detailed information about this operation, as well as about the COVID-19 virus in general. We recognize that this is a time that we must be guided by facts and not fears. And our public deserves to know exactly what is going on. And third and finally, it is our duty to help these people. The friends and families aboard this ship, the passengers who are sitting in fear and uncertainty, we as local government are pleased to step forward to assist our state and federal partners in this humanitarian effort. I also have been clear with our state and federal I've been clear with our state and federal partners about the context of the Oakland community. This is a community that has suffered decades of environmental racism and injustice. And that is why it is so important that we assure this community with the full facts about how their safety and health will be protected. I have received some very strong assurances that this operation will employ the best isolation practices known, that the operation will be conducted in a manner that minimizes the time for the Grand Princess to be at the Port of Oakland, and that once the disembarkation operation is complete, that the ship will depart Oakland, that no one will be quarantined in Oakland or released to our community. We want to appreciate the partnership and the good values of our state and federal partners in this moment. And I really want to extend my gratitude to Danny Wan, the director of the Port of Oakland, who is here with us, all the port workers, the City of Oakland workers that have just come together over this weekend to help and assist in this humanitarian operation. It is the right thing to do. We have to not let our fears dictate or impede our humanity. So with that, it is my pleasure to welcome the great governor of the state of California, Gavin Newsom.
Thank you. Thank you, Madam Mayor, and thank you for your leadership. I want to underscore that, and I will in the course of my remarks. Let me contextualize this moment, and we will have ample opportunity to answer all your questions related to the Grand Princess and the logistical operation that is currently underway. But I want to just update you on the latest numbers. Positive tests in the state of California, number of people we're monitoring, and how we're doing with our testing regime. Currently, 114 people have tested positive in the state of California. We have identified one individual, as you know, in Placer County, that is deceased related to the virus. As you know, he was on this same cruise ship in the previous cruise that went from San Francisco down to Mexico on February 11th to the 21st. We are monitoring some 1,540 individual Californians that were on that original cruise. Currently, we have identified 12 individuals on that cruise that now have identified as positive for COVID-19. Again, that number is fluid. That's the number we have from this morning. Of course, we'll be updating you on a daily basis. Broadly, the state of California has over 10,000, in fact, 10,257 individuals that we are monitoring in 49 health jurisdictions throughout the state that have come in independently of our repatriation flights and independently of the cruises through commercial airlines. So I want to give you the magnitude of the people we're monitoring and the incredible effort that is underway at all levels of government in a state, for those not familiar, that has 58 counties and some 480 plus or minus cities. And so this has taken all of us to work together in a deeply collaborative way, and I'm very grateful for all of our partners, particularly in the health care sector, for their stewardship. And now let's go back to the issue at hand. The Grand Princess currently is some 10 to 12 miles offshore. And I say 10 to 12 because we're moving it back within that footprint. Roughly 2.5 hours away when they have the green light to come in to the Oakland port. We are not prepared to tell you exactly when, and for those passengers that may be watching this, we are not able to tell you exactly when the cruise ship will come into the port, as we are still working out the enormity of complexity of making sure we prepare the site and, moreover, prepare for quick turnaround and quick boarding of individuals to respective locations, which I will talk about in a moment. We want to make sure that all of that is locked in before the ship comes to port, which I think would just create more anxiety for the passengers and, moreover, for the general public. The site was picked. Oakland was picked for a number of reasons. We assessed many different sites throughout the state of California. Active military bases, unfortunately, are not positioned, particularly with a foreign flag cruise ship, as the appropriate site. We looked for mothball old sites, including Alameda. We had originally looked at Alameda as a preferable site, the old naval station there. Unfortunately, some of the silting issues, some of the drafting issues created some concerns, and that site was knocked off the list. Some have suggested, because it's based in San Francisco, this cruise ship, that San Francisco and the port should assume this repatriation effort. That was assessed. The logistics of that site along the Embarcadero, the proximity to residences, the disruption that would have ensued was such that we determined that was not the appropriate site. Other sites across the state of California were considered, in the southern part of the state. And again, by multitudes of assessments, we felt better and more appropriate to have it here in Northern California for reasons I will lay out in just a brief moment. This site allows us a number of advantages. Number one, the ability to secure the site. The site is currently being secured, it's being fenced, and it's being secured by federal personnel. Roughly 10 acres of this site. The site is currently being cleared. We have a number of vehicles on that site, leased vehicles, the ability to contact the individuals that own those vehicles, to look at the existing contracts, to waive the provisions of the contracts, to provide ample opportunity to move those vehicles, presented a logistics opportunity, and we are currently executing that opportunity. The site being cleared is happening as well in real time as it's being secured. But the site offers a number of benefits. Number one, proximity to the Oakland airport, which will provide us the ability to allow foreign passengers on this crew to be repatriated in their home countries, at least in specific terms, to Canada and other chartered flights that are currently logistically being prepared. There will be no contact with the general population and terminals at the Oakland airport. This will all be separate, and all of these individuals are being processed in partnership with the State Department and others for those chartered flights. So that was one benefit of this Oakland site. Number two, proximity to Travis Air Force Base. As many of you recall, the state of California since, late December, but more formally late January, was the state that has provided the most support for the United States and U.S. citizens that were overseas to repatriate them with direct flights. A number of those direct flights went into Travis, into Miramar in Southern California, and Marsh and also in Southern California, but more broadly defined as parts of Riverside. Those operations were successful. The logistics and the preparation of those sites are such that they are advantageous in terms of our repatriation now of this cruise ship. So the opportunity for us in this region, near Travis, near Solano County, Oakland's uniquely positioned to quickly move those passengers to be quarantined disproportionately at Travis, but a number of them possibly down at Miramar. So let me break this out and try to create some sequencing so that people have some clarity. The ship will come in sometime tomorrow. The expectation is to determine what the best cross-current conditions are, as well as tidal conditions, to create the opportunity to have a window for a ship this size to come into a port where it's typically not being docked. I can bore you with the technical details, but anyone that understands this space, no one better than our bar pilots that need to go on to the ship with the appropriate protective gear that needs to be fitted, and making sure that they have the opportunity to have those windows where they have confidence. Those are windows that are typically just a few hours. So in the morning, make up a time, 3 to 6, and then 2 to 4, whatever they may be. There'll be windows, and you'll hear more about those. I'm making those up, but you get a sense of the windows that will avail themselves tomorrow as it relates to cross currents and tides. So that's why we can't give you a specific time. But we anticipate the ship coming in tomorrow. We are also taking care in the immediate term, not only determining when the ship comes in, but providing the opportunity for triage that we will be conducting in the next few hours to occur before the ship arrives. We have what we call these hasty teams that are going to be making their way onto the ship anywhere around 3 p.m. West Coast time today. They will be triaging the passengers. They'll be getting a better sense through screening, through interviews of the needs of the passengers, and that will allow us better preparation on the port property in anticipation of their arrival tomorrow. I want to remind people that are rightfully concerned about the passengers, as all of us are, that the passengers assumed that they would be back home already. Many of them came with medications for the period of time they thought they would be on board, and those medications are also being provided to the extent they already have been. In some instances, people have already been a beneficiary of medications, but obviously with the new medical personnel going on, those will be secured this evening as well. We will move forward by prioritizing those that are most acute. First tranche of people that will come off the ship in a rapid manner will be those that are symptomatic and those most in need of medical support. Those that are in need of hospitalization, and that is a number that needs to be determined, will be sent to appropriate medical facilities in and around the region, and those protocols are well underway for those that we are currently providing care for throughout not only Northern California but the state of California. Next group of people will be California residents. There are currently 2,421 passengers on this ship, 1,113 crew members in addition to those passengers. Some 962 of those passengers are based on our manifest California residents. They will be prioritized, and those California residents will be secured, boarded onto appropriate vehicles and brought again with priority to Travis Air Force Base to begin a 14-day quarantine. Those non-California residents, as I mentioned a moment ago, those that are foreigners, some 54 countries represented in total. That includes crew and passengers. We will be providing those charter flights for the largest cohort of those passengers as another priority to move them forward. Non-California residents, American citizens, will be transported to other locations, disproportionate number, into Texas, Oakland, and into base in Georgia. So that's the current protocol, and that's the current expectation of prioritization and the distribution of where individuals will be sent. There is one cohort rather significant. Again, 1,113 crew members, of which 19 of the 21 that were tested positive are crew members. We will quarantine them, as you may have heard, and it's been publicly stated, on the ship. That ship, after all the other passengers have been attended to, that ship, once quarantined with the remainder of the crew that are appropriate to remain on the ship, that ship will now turn around outside of the San Francisco Bay, no longer in the port of Oakland. This entire operation, we hope, but this is dynamic, so do not hold us to account, is a 2-3 day process. That's what we believe this turnaround will take. That's based on our preparation. And that's why we ask just patience as we prepare the site and make sure the screening is appropriate and to make sure that we have all the logistics at hand so that we're doing this in an appropriate way. It's ready, aim, fire, not ready, fire, aim. And I cannot impress upon you my appreciation, can impress upon you more my appreciation to our federal partners, the incredible work of the CDC, HSS, the White House, the Vice President himself, individually working. We had 3 conversations in the last 24 hours directly. The President direct conversations. The incredible partnership, of course, with our teams at the state level and here locally, the incredible leadership of Mayor Libby Schaap. And let me just end on that point. This would not have happened without leadership. Some folks turn their backs in times of distress, in times of stress. The political answer is oftentimes to abdicate responsibility and accountability. That is not exampled here in Oakland. What you see next to me is a leader that was willing to take responsibility for those in need, take responsibility for American citizens, take responsibility for Californians, take responsibility for many that may end up being residents of her own city in this broader county. I applaud her, and I just want all of you to recognize that she was not required to be put in this position, but she did the right thing, and I cannot be more grateful for her willingness to partner with us in good faith, but with deep expectation of accountability from each and every one of us at all other levels of government. We today have with us a number of other people that will speak, and someone's become familiar to all of you, the HSS Secretary in the state of California, Dr. Galley, who many of you may not know, was working in the health department in the city and county of San Francisco for years, went down to LA County to run their department, and now is the state director. Dr. Angel is here from the Department of Public Health, and we are blessed to have Dr. Red here. Dr. Red is a familiar name for those that have tracked previous cruise ship incidences, substantively the one in Japan. He was disproportionately responsible for that process and the protocols around that. He can discuss and compare and contrast what makes this different and what we learned from Japan and why we are moving quickly to get people off this ship. And I think will give you a sense of confidence in our capacity to meet this moment in a way that could calm people's nerves. Final point. I'm happy at the right time to discuss the inevitable, and that is concerns and anxieties we have around public events and venues in the state of California and public schools in the state of California. Yesterday, we put out guidelines for both. We'll be meeting with superintendents from across the state tomorrow in Sacramento to further those discussions with more nuance and specificity and detail. And anyone that wishes to request any additional information, we're happy to also provide that, as that is, as a father of 4, a conversation I am having often and understandably. Accordingly, each city across this state has also adopted protocols on public venues that is also increased the level of inquiry in that space, and we will happily answer our point of view for the same. So that's where we are in broad strokes. And now with more logistics around the medical component of this, let me ask Dr. Galley to come up, and you'll hear from a few others. And then we're here to answer any questions, including from the Assembly Member Bonta, who's kindly here. Just one moment. Dr. Galley, freely, sir.
Sure. Thank you, Governor. And really, I want to echo Mayor Schaaf, the gratitude we have for your leadership, for being the wonderful partner in all of this hard work. I want to also acknowledge that we've spent time over the past 24 hours talking to our county health partners from the County of Alameda, really digging in this morning to these medical logistics, what is going to happen as the ship comes to port, how can we assure that the workers involved in bringing people off the ship are equipped with the most important and to fulfill guidelines with the CDC and state guidelines, the personal protective equipment, that we have all of the right questionnaires, that we get all of the information from the hasty teams that are going to be on the ship today, and that we're able to assimilate that information quickly to prioritize the passengers coming off the ship, ensuring that we keep exposure to those who might be positive or have symptoms low, and we get them to the right clinical services that they need immediately. This has implications, we know, to the City of Oakland, to the County of Alameda, and broadly across California. And as many of you know, we have been for weeks, months, preparing and escalating our response to COVID-19 across the state, preparing many labs across the state to be able to do testing, asking on a regular basis for supplies for testing from the CDC, having all of those requests fulfilled, ensuring that we're working hard with many of the health providers that stand behind me and across the state of California to ensure that for our increasing cases in the community, we are well prepared. I want to assure you that bringing this cruise ship to Oakland and Alameda is not going to absorb the precious resources that we have in place for testing. We've been working with the CDC and others to ensure that we have additional supplies arriving for anyone who does need to be tested from the cruise ship. Additionally, I'll reiterate what the governor mentioned, that as people leave the site of Oakland, move to Travis and other bases across California and potentially across the nation or to their home countries, that they will not be tested here. They will be tested there. That's important both from a supply issue, but also from a timing issue. We are not holding people at the Port of Oakland to wait for positive tests. They will find those results, if they are indeed tested, at a different location. I want to just thank, before turning it over to Dr. John Redd from our federal HHS partnership, and he will give you additional details about the logistics. I just want to assure you that we continue to sit down throughout the course of the day before we have the ship port to iron out all of the last most important fine details to ensure that staff are safe who are working in this site, and that anyone who's involved in transportation or caring for individuals coming off the ship have all of the details in advance, and that we can assure that they are that all of the procedures meet the highest clinical indicators at the moment. So with that, I want to invite Dr. John Redd to give you more details.
Thank you. Good afternoon, everyone. My name is Dr. John Redd. I'm the Chief Medical Officer for the Assistant Secretary for Preparedness and Response at the U.S. Federal Department of Health and Human Services. It's a pleasure to be here. We're coordinating medical logistics for the disembarkation of the ship and for the safe disembarkation of passengers, and then their safe and rapid transfer to quarantine stations where they will complete their 14 days of quarantine at military bases. First, we want to express our deep gratitude to the state of California, Madam Mayor, Governor Newsom, and to the Port of Oakland for the assistance in this really unprecedented and difficult operation. The first actions we're going to take begin this afternoon. We're going to have mobile medical teams transported to the ship with the assistance of the United States Coast Guard. The first priority of those teams will be to do a rapid assessment of passengers on the ship to make sure primarily that they don't have any unmet medical needs not related to COVID-19 infection. Once we've performed that assessment, we'll know passengers who need to be transferred most rapidly once the ship does tie up at Oakland. After those patients are disembarked, we'll get them as necessary to local medical care. And then we'll proceed with a rapid and orderly disembarkation, beginning with the passengers from California. The approximately 1,000 of them will end up primarily at Travis Air Force Base. Some will end up at Miramar Marine Corps Air Station, and then other passengers as well as the non-American citizens will end up going to their quarantine stations. I'll be very happy to take any questions and look forward to it. Thank you.
Let me end. Well, plenty of questions for Dr. Redd in a moment. Let me just close by saying a number of things. One is we cannot be more deeply empathetic to those that are stranded off our coast. And I know that there's a sense of frustration, deep frustration, that many of the passengers on this ship have, that they're not getting real-time information. And I just want to acknowledge that frustration. And I want folks to know we're doing everything in our power 24/7. This is not a gross exaggeration. It's not an exaggeration to secure their safety, their health as our top priority, and to make sure that we do it in a way that does justice to others in our community as well. And we'll have you home soon. And I know that this is a very difficult time for you, another 14 days for many of you to be quarantined. But it's all about not only your safety, but your family members and your community when you come back home. But you'll be back home soon. Happy to answer questions.
Governor Newsom, over the past couple of days, President Trump has said that he would prefer if none of the passengers aboard these cruises landed on U.S. soil. Did he mention any of that to you in your conversation?
Yeah, we had a private conversation, but he said we're going to do the right thing, and you have my support, all of our support. Logistically and otherwise. So before he made those statements publicly, I had a private conversation with him around 4:30 West Coast time, and he said everything that I could have hoped for. And we had a very long conversation, and every single thing he said, they followed through on. So I'm just not interested in finding daylight on those statements, because every single thing his administration, and it starts at the top, including the vice president, has been consistent with the expectation that we repatriate these passengers, and we do it in a way that does justice to the spirit that defines the best of our country and the state of California.
Governor, the ship had multiple trips. The first trip finished on February 21st. So how many passengers came off the first trip, and do we monitor their situation? Yeah, 1,540 of the individuals that left that ship after that ship came back from Mexico on February 21st are in the state of California, or are quote-unquote Californians. We have not only received the manifest, so we know who those individuals are, but so have our health directors all throughout the state of California. Individuals have been contacted. Many contacted us. And others have been contacted not only by local health officials, but by Princess as a company themselves. We have monitored and are in the process of monitoring them. And as I noted, 12 of them have tested positive for COVID-19. And in addition to that, we had that one tragic loss of life in Placer County from an individual who was also on that cruise. Any other questions? Yeah.
So I understand this is a difficult time, fluid situation. We spoke with Councilman Reed. He says, it really bothers me that my council wasn't notified about what's going on, and we didn't have to say whether the ship should dock here in Oakland. Can you comment on your conversation with the city council?
Sure. Myself and my chief of staff reached out personally to every council member yesterday, beginning with the council member for this district. I did speak personally with Councilmember Reed last night. This was a fluid situation. As I said at the beginning, the official call was not made till 6 o'clock this morning, and initially these conversations, we were advised, were confidential. But I did speak to Councilmember Reed, and again, there are a lot of questions. And I will do everything that I can to ensure that everyone's questions are answered and that that information is communicated to the public.
Yeah. I'm encouraged by the engagement. We had dozens and dozens of conversations personally with folks directly representing this area from the state level down to local level, county supervisors as well. And we will continue to avail ourselves in real time to answer any of those concerns, and we look forward to working with the council member. Anybody else?
Governor, all area
back with positive tests. Of those 21, 19 were crew members, 2 were not crew members. Not everybody that's tested positive, as you know well, has symptoms that require hospitalization. Quite the contrary. Roughly 80% of people that have the novel coronavirus have mild, relatively mild symptoms. A small percentage will need more acute care. We're determining and triaging the number of individuals that may need that acute care. But because it skews younger, as crews tend to skew younger as well, we are not in a position to believe that there are hundreds and hundreds and hundreds of people that are going to require immediate hospitalization. Quite the contrary. If there were, we have more than enough capacity in our system. As you know, we've been making this very public over the course of the last number of months, not just days. We've been running tabletops, pandemic exercises. Every local jurisdiction requires their own pandemic planning. The hospital system in the state of California, to put it in perspective, has over 80,000 beds. The hospital system is required to estimate surge capacity anywhere from 10 to 20%. And in addition to that, we have identified state sites all throughout the state of California. I did an emergency declaration a number of days ago to make the siting of those and the regulatory and licensing much easier and efficient. So I can assure you, even in the worst case scenario, and we're not anticipating that, that we're well resourced to accommodate the needs of these passengers, even if it's a large number that come in acute condition. I don't know the details of that specific memo, but I can just broadly assure you and assure the general public that I don't think I know, having participated actively in these scenario plans, that our healthcare delivery system is extraordinarily well resourced, and our planning is well underway, and our surge capacity to meet the needs in the immediate term exists. And will continue in a dynamic way to evolve. And I want to remind people the dynamic nature of this. I mentioned today 114 positive cases. I think it was 88 yesterday. You'll start to see these numbers increase. The testing, as you know, has been relatively modest. For those that are curious, the state of California has the capacity to test just shy of 8,000 individuals. We have the ability to test them in 15 different labs across the state of California. On Monday, tomorrow, one of our larger private contractors, commercial contractors, Quest, has the ability to test roughly 2,000 people each and every day. Quest has a facility down in San Juan Capistrano, just south of Laguna Beach, and they will be accepting those testing protocols and kits as early, as I said, tomorrow. So the testing protocols and regimes, as they evolve, more people are tested, more people are tested positive. You will start seeing those numbers increase. It's exactly what you should expect. It's exactly what we have planned for. And there's a subset of those that test positive, a small subset compared to the total numerator, that will need acute care. And in that capacity, we have scenario plans, I can assure you, throughout the state of California, logistical strategies that not only include appropriate protective gear, but resources to provide that care, which means personnel, nurses, and the like, as well as the physical facilities in traditional hospitals, some other facilities that we can make quickly available that were mothballed hospitals, and other private facilities that we use for this kind of planning and purpose.
Was there a city that you asked that said no and then asked the city of Oakland?
No, we assessed the most appropriate location. To be candid with you, after all the assessment, the geographic, the logistical assessment, the proximate issues that I referenced a moment ago, the Alameda base was the preferable site, candidly, as it relates to the first look. This site provides, I think, in some ways even more logistical benefits rather adversely, but that was, if there is some sort of prioritization, that would be roughly the sequencing of consideration beyond the deep, deep consideration across all of the state assets along the coast of California.
Governor, has any additional passengers shown symptoms? And the second question being, how many Californians have actually been tested to date? Do you have that information?
Yes, I do. It's a very modest number of people that have been tested. The last estimate, Dr. Angel can correct me in real time. This is going to test my capacity as well. 788 individuals.
That's pretty darn close.
All right, so let's take my word for it. That's over Dr. Angel. I think maybe we have that backward. But the last number that I received this morning was 788 individuals have been tested. And again, the testing protocol is radically about to take a new, well, it's going to evolve very rapidly as now the commercial programs, not just Quest, but LabCorp, which is in North Carolina, starts accepting these tests as well. But as I noted to you, we have 15 labs, 19 labs that have test kits, 15 labs as of this morning, that can process those tests. One of those labs was Richmond, that tested the individuals on the Grand Princess. I should note that that process, people are curious, you can process, at least at Richmond, 20 tests within 4 hours. That does not mean everybody's notified within just 4 hours, but the tests are processed about 20 at a time within 4 hours. As we expand our capacity with these other locations and obviously have Quest that is purposely in this business, or rather principally in this business exclusively, that testing capacity just at that one location in San Juan Capistrano will exceed 2,000 tests per day. Oh, the symptoms, we are not in, we do not have the benefit of that information, but quite literally in the next few hours we will, as what they refer to as these hasty, I know, these hasty teams, interesting way of referring to teams, that Dr. Redd referenced a moment ago. He could talk more substantially about that. Begin the interviewing, begin the screening of individuals, and talk to the medical personnel on board about their latest assessment, and we will have that information coming back over the next number of hours. And Dr. Redd, I'm going to take advantage. When you have you shouldn't be asking a governor any questions when you have Dr. Redd.
Well, in reference to the assessment this afternoon, we've been in contact with the medical crew on the ship. And as of now, we don't have information that there are additional people with symptoms that are compatible with COVID-19. But the plan is to go on board the ship and liaise with the medical providers there, and then subsequently begin to assess. So we will have more information as that is ongoing.
Doctor, do you know where the ship will board after they're done with the quarantine?
too early at this point in time?
I apologize. I don't understand the question.
So once the ship is turned around, the next 48, 72 hours after they are docked, and once the rest of the passengers are removed from the ship, once we've secured the ship and quarantined the crew, then that ship will turn around, and they are currently assessing appropriate places to bring that quarantine ship. But it will not be here in the San Francisco Bay.
Dr. Reed, what protocols are in place to help the Port of Oakland employees and people who are working there? They're obviously concerned.
Well, so to imagine the site, the way that I look at it is first literally imagine the distance. So first of all, there's a secure barrier that's being placed around the area. It's a little under 11 acres. So the primary method at first is distance, and that's being secured by federal law enforcement. And then there's very, very tight control over people who pass in and out of that zone. And we have extremely tight controls on passengers, whether symptomatic or not, who are being disembarked from the ship.
How will the airport be secured? You mentioned the Oakland airport. How will that not interact with the public?
I'm happy to.
Two different airports.
Yeah, so this is not even connected to where you see commercial passengers. So it's completely separate, no terminal connection, no individual connection, similar protocols, people, personnel, protective gear, individuals brought directly to tarmac, directly on these chartered flights, no contact with the general public.
Can you expand on some of the lessons that were learned from the government of Japan? I understand that, for example, this is taking place a lot quicker than their evacuation.
Yeah, no, thank you for that.
We have been in constant contact with the government of Japan. I just returned from Tokyo on Monday. I was part of the team that was working in Yokohama and Tokyo on the Diamond Princess quarantine. There are several differences that are quite pertinent regarding the situation in Japan and here. The primary one I would say is time. We are not maintaining passengers on the ship for maintenance of quarantine. In fact, quite the opposite. We're making every effort to get them rapidly and safely off of the ship and then transported safely to a location for quarantine at which they can be observed for 14 days and at which they can get rapid treatment for medical conditions that come up, whether related to COVID-19 or otherwise.